So this is our study. This is a presentation I made actually 2 months ago when I presented this at the Borealis conference in Sweden. And you see here it's under review, but it's no longer under review. This paper got accepted to scientific reports, and it will be available online, I hope, in the next month or in a couple of weeks. Let's see. This study is a work of me and my colleagues. First is Neil Tadmor. He's my colleague. He's also originally based in Israel, Palestine, no longer live there. He's working together with me in Impulse. It's an integrative clinical center for psychotherapy, psychedelic integration, and psychiatry. Second is Michael Skarga from Sweden. Jules Evans from Challenging Psychedelic Experience Project, and Oliver Robinson. And we started this paper after Jules and colleagues published their very known by now paper on challenging psychedelic experiences. Me and Nir also contributed to this paper that they made. I added a question about traumatic experiences, and I asked Jules to add the following question. Do you link your traumatic experience from the past to the challenging psychedelic experience you underwent? And many people, you will see this now, said yes. And this was very kind of mind-blowing for me, that a traumatic experience from your past can kind of make some of an effect on your challenging psychedelic experience. So this is a work that is made from that question, and you will see it soon. So we designed a study, but we had some context for this study. So while clinical psychedelic research can demonstrate promising therapeutic outcomes, as you all know, naturalistic use is really under-researched. But naturalistic use of psychedelics represent approximately 99.9% of all psychedelic experiences in the world. Please turn off your speaker or microphone. I hear myself. Thank you. So the naturalistic use of psychedelic is under research. This is really crucial for me. I want to understand better naturalistic use. Most of people, this is the way their psychedelic experience is shaped and looked in the psychedelic experience. We know a lot about clinical settings, but we don't know enough about what happened to people that they're having their psychedelic experience with their peers or with their partner or with their friends or by themselves, etc., etc., etc. So we gather 18 people from a very large cohort that Jules and colleagues created, 608 people. And we wanted to understand their subjective experience under psychedelics and specifically the trauma that they re-experienced during the experience. And we know by now that psychedelic use can intensify psychedelic experiences that hold autobiographical memories. So people under classic psychedelics or also MDMA can experience vivid autobiographical memories. They can be very emotional. very distressing, but also very, very beautiful. We know that psychedelic can create adversities after an intense, challenging, or difficult experience. We can feel hurt, feel disturbed, confused, sometimes even traumatized. We know, as I just mentioned, that trauma can resurface, sometimes through the memories, but sometimes it's a vision or fragmentation or a somatic experience. And of course, the paradigm now is that we can go a psychedelic experience, or we should go into a psychedelic experience to kind of resurface the trauma, interact with it in this window of tolerance, change the relationship with the trauma, changing our rigid thoughts towards the trauma, self, and world, and experience healing. But those experiences can be also traumatizing or re-traumatizing. Depends on what surface. So this is the context. There is gaps in the knowledge. Trauma and psychedelics are the main paradigm in medical use of psychedelics, but this phenomena is remains significantly under researched. Yet paradoxically, of course, trauma processing has become the controlling paradigm and the primary aim of clinical psychedelic therapy, and widely considered central to therapeutic outcomes. So we need kind of to get close to our trauma during the psychedelic experience. Given this disconnect between limited research and widespread clinical application, our study aimed to explore how recalling childhood trauma during psychedelic experiences related to extended psychological difficulties and positive outcomes also. So for that, we formulated two research questions. And first is, how do people experience and understand childhood trauma surfacing in psychedelic session, including memory, emotion, body sensation, and meaning making? And second, what factors influence whether these trauma-linked experience led to integration, ongoing distress, or re-traumatization after the trip? So we have two phases to this mixed method study design. First one involved working with the Challenging Psychedelic Experience project, which I just mentioned, and their dataset from the survey of 608 participants who had post-psychedelic difficulties lasting beyond the immediate effects of the drug, the adversity. In the survey, and this is the question we asked, was there a traumatic experience in your childhood or youth which you think may have played a role in the difficulties that arose during or after the psychedelic experience? And participant could answer yes, no, or unsure. From this larger survey sample, we then selected participants for in-depth interviews, which we referred to as phase two. This phase involved semi-structured interviews with 18 participants who had indicated a trauma link in the survey. So they said yes. Our interview sample consisted of 12 females and 6 male with ages ranging from early 20s to late 50s. And the substances involved were mainly psilocybin, this was 10 participants, ayahuasca 6, LSD 2. Half of the participants had guided session, while the other half had unguided session. So recreational, party, etc. We used thematic analysis combined with multiple case narrative methodology. This is the qualitative methodology that we used. So our study, of course, have several limitations. Most of the psychedelic studies had lots of limitations and biases kind of fundamentally integrated in them. So our findings are based on retrospective self-reports, which are vulnerable to memory distortions and interpretive bias. When participants reconstruct past experiences, they need to build a coherent narrative. So it's not empirically kind of fact check. We cannot do that. They cannot do that. The 18 interview participants represent a non-random subset who volunteered to discuss traumatic experiences. Okay. Third, we had no independent verification of the traumatic memories that participants recalled during their psychedelic experience. So our data therefore reflect participants' subjective interpretation and perceived connection to childhood trauma rather than verified historical events. So this is kind of the quantitative part of our paper from our survey with the Challenging Psychedelic Experience project. So here you can see that 41.8 of participants believe childhood trauma contributed to their psychedelic difficulties. 31% said no, and 27.2 were unsure. The unsure group was excluded from the statistical comparison. Those reporting trauma link were more likely to be older, female, have pure diagnosis, and use psychedelics in guided rather than recreational setting. Despite challenging experiences, they believe psychedelic benefits outweigh the risks. Post-trip, they reported more emotional after effects like anxiety, mood swings, etc., but fewer perceptual disturbance, visual, auditory anomalies. All differences were statistically significant in this. These findings might suggest several explanations, and we will discuss this afterwards. You will tell me what you think. But older participants may draw on past experiences to interpret psychedelic difficulties. So people that are older might have more memories. That's the first thing. And during their life, they reflected on those memories more. So we can say that their container is bigger. And of course, we also kind of hypothesize about midlife crises and going back to memories and kind of rethinking them, etc., etc. There is the guiding thing. So here it's very complex, and I would love to hear what you think afterwards. But guided sessions or therapeutic sessions might suggest traumatic memories, or kind of push will be a very hard word to put here, but it gives context to the experience. So this might represent the numbers that we see. So of course we know about set and setting, and if this is the set and this is the setting, maybe this will be the outcome. Gender differences, this is very difficult, but what we say, interpret in our paper, is that women high rates of interpersonal trauma. It's related to many, many things, but women do tend to seek more help and talk about what they experienced and have a process with this. I don't say that men don't do that, but through research, we see that women tend to do that more than men. But we will have this deeper talk in the discussion. All right. So the qualitative findings. So every interviewee experienced some form of past trauma reaching conscious awareness during their challenging trip, though the moods of resurfacing varied between the people. 39 experienced explicit re-experience of vividly reliving specific traumatic events with intense sensory and emotional detail. Crucially, 3 participants explicitly stated these were new memories not previously recalled before the psychedelic session. Basically, what they're saying is that the psychedelic experience they're saying, revealed a memory that they were not aware of before. 22% encountered trauma through symbolic or somatic recall, symbolic imagery, bodily sensation, or overwhelming emotion they interpreted as linked to their early trauma. This might suggest that trauma is remembered, quote unquote, through symbols or somatic experiences rather than through narrative memory alone. We all know the body keeps the score. This is also a very big paradigm, and popular books about psychology, self, and mind are very big players in the set and setting. And half of our participants experienced fragmentation and confusion with fragments of memory and feeling that were difficult to piece together. They struggled with the uncertainty about what was real versus hallucination, leading to doubts and distress about the authenticity of their experiences. So, in the psychedelic experience, and we'll have this conversation soon, it's more than a sensation or a feeling, or yeah, you can feel it in your guts sometimes, but you don't see images or you don't have specific memories coming up. Um, yeah, so this is what a lot of the people experience when they talked about the resurfacing of the trauma. It didn't appear as a vision. It didn't appear as a memory. It appeared as a sensation. So in the following slide, I will share quotes that demonstrate the certainty of some participants felt about the recovered memories, even though they had no pure conscious recollection of those events. This might be disturbing, distressing also. So to honor their voices, I will let you read them silently. I will not read them. And I will take maybe a minute to give you the opportunity to read them. I will have two more slides after the next one. So it will take us, let's say, 3 minutes. So just uh, read them to yourself, and if you feel it's too much for you, please just take 3 minutes off, go have a glass of water, and come back. Those are direct flashbacks of the traumatic experience, traumatic memory or vision. The following quote slide will present the somatic experience of recall trauma in a psychedelic session. So I hope you all had the chance to read that. And the last quote slide will present how uncertainty itself became traumatic for many of our participants. I hope, again, you all had a chance to read. So, in our study, participants were not only haunted by the content, but also by the epistemological crisis of not knowing what was real. The uncertainty raises a key question for us. Not did this happen, but how do we support someone when the truth is unknowable? So some participants spent months or years tormented by this uncertainty, unable to move forward without knowing if they uncovered a real memory or experienced a convincing but non-veridical construction of their memory. And we talked to people that are in their 50s, even their 60s, that their experience happened 30 years ago, and they are still not sure if it was a memory, and they can, some of them never got the chance to find out. So they're carrying this with them. So you can understand how the psychedelic experience itself can become a traumatic event. Some of them went and talked with their father or other figures. And as you see here, they said, no, it didn't happen. But the vividness or the intense experience were very, very clear to those participants in our study. And they linger with this unknowing. So the distinction between veridical recall and metaphorical manifestation is crucial in the context of psychedelic experience. There is a single case that we read at some different paper by Timmerman et al. And they are talking there about a single case of childhood abuse memory from a psilocybin experience that the participant initially thought are truthful, but during the integration sessions, this participant kind of reinterpreted the memory and kind of reflected this as a symbolic kind of manifestation of the unconscious. I'm not sure. I'm not sure if it was a decision for them to kind of change their perspective, or they just also got this no from the people in their surrounding. But staying with this experience, as I said, itself can be terminated, um, and very, very difficult to hold. And in the study, there is one quote that I will share now. When it happened, it felt more real than the here and now. But what do you do with this afterwards? So there is, of course, outcomes that we checked with our participants. So longer term outcomes fell into three trajectories. So 50% achieve positive integration, um, with the support of therapeutic kind of intervention that they got, most of them. Another 28 had mixed outcome, experiencing both healing and lingering challenges. As one recalled, overall, it was a very healing experience, but not having a closure about it, the childhood trauma, was harmful for me and my family. And the remaining 22 experienced re traumatization, full on re traumatization with PTSD like symptoms. One reported, I didn't cope well afterwards. I had a lot of problems with sleep, and I was having flashbacks from the experience. And those who found purpose in their experiences, like discovering a calling to help others, achieved what we call post traumatic growth. And constructing a coherent narrative from fragmented experiences proved as a crucial mechanism for recovering from the challenging psychedelic experiences, as developing a redemptive narrative that framed adversity as a path to growth rather than a senseless suffering. So, narrative coherency are crucial. The key differentiator was, of course, the integration. If people really had the chance to integrate, some of them had those experiences when they were very, very young, or therapeutic framework was not available. So we need to make therapeutic frameworks available to people that are undergoing challenging psychedelic experiences. And we need more therapists that are psychedelic informed. And positive outcomes correlated with therapeutic frameworks, as I said, and active integration through therapy. We can also mention here meditation, journaling, and peer groups. Adverse outcomes often resulted from inadequate support, leaving individuals to cope on their own. Some of the participants in the study mentioned that this is the first integration that they're doing, and we only had an in-depth phenomenological talk about their experience. We didn't do anything therapeutic. Yeah. So in our study, we highlight the importance of trauma-informed care during psychedelic integration. Clinician performing post-trial integration must be well trained in trauma-responsive techniques, even for brief follow-ups. And we highlight that. Integration is essential for lowering adversity and promoting positive outcomes. Post-session support through therapy, journaling, support groups, or meditation can be transformative for people's experience. And no one experiencing trauma distress should be left alone with it whatsoever. So there is context and places that don't give this integration process, just throwing you on the next plane and you're flying half-ward to deal with your experience. This is extremely dangerous. Comprehensive protocol must include trauma-informed screening before psychedelic session and explicit informed consent, ensuring, and this is what we think, participants understand they may re-experience trauma or construct trauma memories that were not previously present. And of course, this might be suggestive, but people need to enter those experiences with full acknowledgement of what might happen. And they can also kind of contemplate on with what framework or paradigm I'm entering this experience. So if I want to meet my trauma, maybe I will meet a trauma and maybe I will construct this trauma without this trauma even being present. Finally, suggestibility of psychedelic states also present a unique risk, and facilitators who believe everyone has buried trauma stored somewhere in their body and pursue aggressive and regressive exploration may carelessly view its discovery. Therapists should neither confirm nor dismiss these experiences, but instead hold space for uncertainty while focusing on emotional processing over factual verification, supporting the client's emotional experience as valid while remaining agnostic about the literal truth. So, what we've observed is that trauma recalled during psychedelic state doesn't emerge in isolation. The interpretive frameworks people bring to these experiences, whether clinical, psychological, or trauma focus, fundamentally shape both what surface and how it's understood. When we rely too heavily on the individualistic models of healing, we risk flattening these complex relational and culturally rich experiences into narrow narrative of recovering and personal optimization. And this reductionism reflects what might be called the trauma paradigm. And we think it's a cultural lens that prefers individual psychopathology over the minimal, symbolic, collective, and contextual understanding of the experience. And perhaps the real task is to keep the field open to recognize that trauma, memory, and meaning under psychedelics are always culturally mediated, and that healing requires more than a clinical framework. And the study demonstrates that integration depends not only on the therapeutic framework, but also on the meaning making resources that are available, the proper support, and the capacity to hold uncertainty and complexity. And if we lose sight of this complexity, we risk turning psychedelics into standardized intervention and stripping them of the collective and liminal and transformative potential that might make them both healing and disruptive, but always um, incredible, incredible. And I think that note, this is the final slide that I will present. So, yeah, that's it.